Hi, my name is Ashley Wayne Grimes. I am the owner and CEO of Cannabis Nursing Solutions. I am here to talk to you today about some of my work. Some of the work that I've done through advocacy and policy in cannabis medicine. I am a master's prepared nurse. I've been a nurse for over 13 years. I have certificates or certifications in professional development, and I have a Lean Six Sigma black belt. So we're going to go ahead and get started. Before we start, though, go ahead and give me a follow at Cannabis Nursing Solutions on Instagram. And you can find me at www.cannabisnursingsolutionsllc.com. So the title of my presentation today is Policy and Advocacy Through Children's Literature. So we're going back in time a little bit, back to February of 2020, Connor's Courage. And this is an article titled "A Local Teen with Autoimmune Disease Backing Bill to Allow Medical Marijuana Inside Maryland Schools." This is before I got involved. This was a young child who needed access to his cannabis in schools. So I got the video here for you today. Let's see. Stop share. Go to this.
MD.org. A new bill in Maryland is being backed by a young kid.
He says if it wasn't for cannabis, he would have never had a childhood, crediting medical marijuana for making him better.
Annie Rose Ramos has the details. This was Connor Sheffield 2 years ago, confined to a bed, hooked up to feeding tubes, his body pulsing with pain, suffering from gastrointestinal dysmotility, an autoimmune disease that kept him from digesting food properly. This is Connor today, happy, healthy, doing what he loves most. He credits the turnaround in his health to cannabis. How do you take it?
Put it under my tongue, take a swig of water. That's it. It's meant no more hospitalizations. It's meant that I've avoided going into palliative care.
Connor is one of nearly 200 children certified to use medical marijuana in Maryland. Now, he is fighting for a new bill that would allow him to take the drug in small doses at school. How important is it for you to have it every few hours?
I need it every few hours. You know, it's the difference between life and death, really.
After trying every other medication, his father says it's the only thing that's worked. It's called House Bill 331, or Connor's Courage, and would allow Connor to take medical cannabis in a nurse's office on school property. Currently, cannabis on school campuses is illegal in Maryland, so Connor has to leave school to take it, or go without it.
And some days we travel for work, so we're out of town. So those days, he just has to go without his medication, and it hurts his schooling. He's not focused.
Connor says it gets him through the school day.
Well, you can take opioids or, painkillers and all that stuff in the nurse's office, but I can't take my cannabis, which would get me through the day.
Annie Rose Ramos for WJZ.
That was back in February 2020. That was in the local news here in Maryland. Since then, House Bill 617 is actually the bill that passed. It was called Connor and Raina's Law. It passed May 8th of 2020, and basically it authorized a parent or legal guardian of the medical cannabis patient under the age of 18 to designate not more than 2 additional adults to be a caregiver. In addition to the parent or legal guardian, specifying that the definition of a caregiver does not include the designated school personnel, authorizing qualified patients under the age of 18 to obtain medical cannabis from certain designated school professional, exempting certain caregivers and school personnel from certain penalties related to the administration of cannabis, etc. In a nutshell, that basically means that they are now, the children who are medical cannabis patients here in Maryland have access to their medical cannabis on school grounds as long as it's provided by a designated personnel. Before this bill passed, a patient can only have up to 2 caregivers. and no other person could administer medical cannabis. Since then, they added this clause here that basically says that designated personnel, i.e. a school nurse or anybody else designated by the school, is allowed to administer medical cannabis to the child on school campus. And this is where the nurse comes in. I mentioned earlier it had to be designated by school personnel. A lot of times, based on this bill and based on the role of the school nurse, it ends up being the school nurse. My participation actually came with a work group with the Maryland State Board of Education and the Medical Cannabis Commission, which basically said that they needed guidelines for public schools to outline how schools will administer medical cannabis to their students. So here's just a clip of what those guidelines state in summary. I won't read it here, but basically is saying that you can administer medical cannabis to qualifying patients during school hours at school-sponsored events and on a school bus by state law, and in an effort to facilitate continuity of medical care and education. So that's just a clip from this summary right here. But my work on this in this group was pivotal to me, and we'll keep going from here. So my contribution included explaining to them the onset and duration of cannabis through different modes of administration. So you can actually take cannabis sublingually, through ingestion, transdermally, through topicals and suppositories. There are considerations for the nurse to think about when administering these, and the onset and duration, as with any medicine, is key to how we treat the patient. There are also safety considerations. And to the right, you'll see a clip of a slide that goes through, and it's hard to see it here, but basically it talks about the terpenes, which is part of the genetic profile of the plant. And I identify all of the terpenes that are included in the plant. I talk about what their medical benefits are, where it can be found in certain food sources, and potential effects, which is important. And I'll highlight why it's important to identify the different foods, because sometimes children or people can be allergic to certain foods because of the specific terpene that is in that plant. And of course, it could be other reasons, but if a child, for example, is allergic to lemon, and it happens to be because of the limonene that's in the plant, that also exists in medical cannabis. And that's something that the school nurse should be aware of on the front end. And while I was working on the group to develop guidelines, and I will say they are well-written guidelines. They absolutely meet the needs and the goals of what we were trying to complete. But there are so many questions. As a nurse, as a healthcare professional, and as an advocate, I wanted to know about the social impact. Children socializing with other children who may be on medical cannabis patients. How about the parents who have an antiquated view on cannabis and educate their parents on that view? Or the role of the school nurse, or educating teachers, all while considering the child who has likely dealt with so many struggles due to their medical condition. We don't want the fact that they have found the cure or the solution, not the cure, I won't claim it's a cure, the solution to their medical issue to also cause more trauma while they're trying to re-enter a social environment. So that's why I wrote ACE's Medicine. ACE's Medicine is actually about a little boy who goes to school, and he moves to Maryland by happenstance, and he goes to school, and he has to take medical cannabis every day. And he tells his class, hey, I have to go take my medical cannabis, and he happens to be bullied. And so him and the school nurse go and teach the class about medical cannabis, why he has to take it, and just, some other considerations. They talk about the history of the plant in very basic terms. And the reason why I wrote this was because of those social issues that in my head, I question. So it touches on the role of the school nurse. It touches on the teacher's role in interactions with the children. It touches on, other children's perspectives based on what they're taught at home. So that's why ACE's Medicine was born. And here's some of the imagery. Right here in the middle image is Asa in his messy room. We all know that children don't take care of their rooms, at least mine don't. And to the right, you'll see Miss Eliza, that's Ace's teacher, and she's shocked because Ace is asking for his medical cannabis. And to the left is the cover and summary. So you can see that I use very vivid colors and pictures and diversity included, and is embedded all throughout the book. And Asa teaches the class with his school nurse. So to the left, you'll see Nurse Ashley, and her nursing process is on the wall. But here's a couple of quotes from the book. After school, he came home to tell his dad how great his day was. He said the children were very nice and I taught them something too. Asa's dad said, "Oh, really? What did you teach them?" Asa told his dad, "Everyone is different and has different needs, which really means we are all the same." So in conclusion, Asa's medicine is one boy's story. And Asa happens to be well-informed, happens to have Asa's medicine is a story of one boy, and it happens to have a well-informed school nurse to support him. Most schools or most school nurses do not have the tools or the function or the ability to educate the classroom on medical cannabis. It is not taught in nursing schools. It is not taught in general practice at this point. And as trusted healthcare professionals, educators and school nurses, we are in the unique position to inform the community, parents, teachers, and other students the differences between recreational cannabis use and medical cannabis. And as the use of cannabis grows, so will the need for nurses with advanced education in this specialized area. So, in a nutshell, Asa's medicine is just one step towards advocating for the use of medical cannabis and the understanding of the general public in cannabis as it grows in popularity. And my work has a long way to go and will continue to keep moving forward, but Cannabis Nursing Solutions strives to educate healthcare professionals, nurses through our training programs, through coaching and mentoring and other services from business to business and to the consumer by providing them access to evidence-based information. So thank you for listening to my presentation today. Again, my name is Ashley Wayne Grimes. I'm from Cannabis Nursing Solutions. You can follow me at Cannabis Nursing Solutions on Instagram or email me if you have questions, cannabisnursingsolutions@gmail.com. Thank you.